Greetings to you all, ladies and gentlemen. I'm Chadema Hazel, and I'm going to be presenting on the drug used in the radiology department, fluorouracil. So, below are some of the objectives that I'm going to be explaining during my presentation. Introduction. Fluorouracil is a pyrimidine analog used to treat basal cell carcinomas and as an injection in palliative cancer treatment. Its generic name is Fluorouracil, and these are the brand names. Its chemical formula is C4H3FN2O2, and it has got a half-life of 10 to 20 minutes. So, fluorouracil has got three possible mechanisms of action. And firstly, I'll be explaining them. So firstly, fluorouracil metabolite competes with uracil to bind with thiamidelates synthetase TS and the folate cofactor. This results in decreased thymidine production and therefore decreases DNA synthesis and repair, and ultimately decreases cell proliferation. So if there is decrease in cell proliferation, meaning to say the tumor will no longer be growing, thereby treating cancer. The second mechanism, the fluorouracil metabolites is incorporated into the DNA, thus interfering with DNA replication. And thirdly, fluorouracil metabolite is incorporated into RNA in place of uridine triphosphate, producing a fraudulent RNA and interfering with RNA processes and protein synthesis. So fluorouracil is cell cycle specific. It's more concentrated in the cell cycle, specifically on the S phase, and the diagram below shows all the three mechanisms of fluorouracil. On this slide, I have got the structural formula of fluorouracil, and I'll be explaining the pharmacology of uracil, which includes the mechanism that I've already stated, the uses, and the adverse effects, which are also in the following slides. So, as I stated, the molecular formula C4H3FN2O2 of fluorouracil. It is considered the most active anti-neoplastic agent, and it needs to be converted to nucleotide level in order to exert its effects. It can be incorporated into RNA, leading to interference with the motivation of nuclear RNA. Now I'm on pharmacokinetics. So, a high-pressure liquid chromatography method has been used to investigate the pharmacokinetics of fluorouracil after a single IV dose to patient. So, the plasma level of fluorouracil declined rapidly after dosing. The mean half-life was 11.4 minutes, and drug was essentially cleared from plasma in an hour. So, under pharmacokinetics, these are how the drug is excreted from the body. So 60 to 90% of the administered dose is excreted in urine, and the remaining percentage is excreted during metabolized primary in the liver. These are some of the therapeutic uses of fluorouracil, as it is one of the most commonly used drugs to treat cancer. It is most often used in combination with other cancer drugs to treat many types of cancers, which include breast cancer, head and neck cancers, anal cancer, stomach cancer, colon cancer, and some skin cancers. And for skin cancers, we use ornaments or creams to treat the skin cancers. This image shows a lady with skin cancer before and after treatment using fluorouracil, and nextly there is a stomach cancer before and after treatment using fluorouracil. So there are mainly two methods on how the drug is administered into the human body. Firstly, through intravenous, and secondly, as an ointment for skin cancer. As I've stated that for skin cancer we use ornaments or we use creams, and the creams is applied on the skin when one has to wear gloves and apply the cream using the tips of their fingers. And for the intravenous, they use an injection before administering it into the patient. So the question comes, when do one have fluorouracil? So the patient usually have fluorouracil as part of a course of several cycles of treatment. So generally the patient have up to 6 cycles of treatment, and each cycle lasts 2, 3, or even 4 weeks dependently. The patient will have continuous treatment through a small portable pump, especially for intravenous, whereby we'll be using the injection, administering drugs into the vein. So the nurse attaches it to your central line, meaning one can go home with it, or even come back to change the pump. So below are the precautions that need to be um, that needs to be followed, so as to avoid unnecessary effects or unnecessary damage to the human body. The precautions include before starting fluorouracil treatment, the patients must make sure they tell the doctor about any other medication they'll be taking, and also the patient must not be taking aspirin or products containing aspirin. The patient must not receive any immunization or vaccines without the doctor's approval whilst taking fluorouracil. Also, the patient must inform healthcare professionals if she is pregnant prior to starting this treatment, because fluorouracil may have effects on the fetus. The patient must not breastfeed whilst taking fluorouracil. These are some of the side effects that are noticed after one has been administered the fluorouracil. So fluorouracil may cause some of these various and different side effects in different people, which includes mouth sores, watery eyes, sensitivity to light, discoloration along veins through which the medication is given. Some may even vomit and have diarrhea, and also low blood counts. And these are the references where I got much of the information. This is the end of my presentation. Thank you.